everyone. Welcome back to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Kandace Kichler. Today's guest is Dr. Mary Alice Mina. So Dr. Mary Alice Mina is a Harvard-trained dermatologist, international speaker, author, and host of her own podcast, The Skin Reel. Her podcast ranks in the top 2.5% globally. And as co-owner of Balcom and Mina Derm Surgery in Atlanta, she's a leading expert in procedural dermatology, skin health, and skincare. With nearly 2 decades of clinical experience, which obviously you can tell she doesn't look like she could have worked for that long, Dr. Mina is celebrated for her artistic eye, surgical precision, and ability to help patients feel radiant at every stage of life. So welcome, Dr. Mina.
Thank you so much. Yeah, you're too kind.
It's true. I mean, you look my exact age and I'm 22. So
I know, right? What's funny? I used to get all the time, like, you're too young to be a doctor, but I don't get that as much anymore.
yeah. But the thing is, you look much younger than I'm sure your real age, which is a compliment in itself.
Yeah. But,
No,
I feel like, do you feel pressure as a plastic surgeon to kind of look this certain part, that people expect?
percent. And I struggle with, like, I still occasionally will get that, well, how old are you? You look so young. I don't get it as much as I used to, but I struggle with that balance. It's like, okay, I want to be perfectly Botoxed and have like porcelain skin. But then if I look too young and I have no movement, then people start saying that comment all over again.
Yes, exactly. Yeah, it's a fine line. And I think in our specialties, we have access to so many devices and techniques, and I know who to call for this or that, and so you just have to be careful to, like, not to. It's a fine line between looking really good and then taking
Looking
it too
crazy.
far. Exactly.
Yeah.
Yeah. So
No,
you got to walk that fine line.
Totally. I did like several syringes recently, like all at one time, like 4 or 5. Like it was a lot because I usually do 1 or 2 here and there, space it out. And I did like a bunch, like a full face. And I was so swollen for so long. I was like, oh my God, people are definitely saying I look like a freak right now. We need to get this swelling down.
Well, yeah, it came down. So you look great.
It did. Yeah, it did. Thank God. Okay. Well, I have a ton of questions that my audience is interested in related to skin health, dermatology, cosmetic dermatology. So I just want to jump right in if you're ready.
Yeah, let's do it.
Okay. So what are the most common misconceptions that people have about skin health?
I think a lot of people think just putting a cream on or a serum, like one product, is gonna fix everything. And they keep jumping around. They'll try one thing and then some gorgeous celebrity comes out with another. They try that and they never give anything enough time to work. And they're also neglecting all the other important things to be doing. So a lot of our topical products, I mean, they can do amazing things, but it's kind of like when they say you can't outrun a bad diet, right? Like you can't just work out and eat like crap. Like you have to. The topicals are important, but there are other things as well. Between taking care of your body as a whole is huge. I don't think we talk about that enough. And then of course all the in-office things, surgical things, all these other options, but that one cream on its own, maybe with the exception of sunscreen, is not necessarily going to work miracles.
I know. I feel that in my soul because I'll try something and I'll get the same, kind of like urgency or eagerness that a lot of my patients get. And I'm like, well, I don't really see any difference. But if you give it time, that's when you start to see some changes. And like you said, when you combine things together, like, okay, we're going to address the hydration this way or the pigment that way or the resurfacing another way. Like you can't have it all with one product, at least not, there's no miracle cream.
Yeah, and I'll one of my favorite products, I'll say pretty darn close to a miracle cream is a retinoid or tretinoid, and I've been using that for decades. And I remember, I think I really started using it in my late 20s when I was a dermatology resident. I'd used it before when I had acne, but I was just for acne. So I started using it, and I remember thinking, I don't see any difference. Like, I don't
Hmm.
see what the big deal is. And I clearly remember this one time I looked in the mirror and I saw it. I was like, "Oh, my skin does look good. I can see that it's doing something," but it took a year of consistent use before it registered for me. So I just kind of tell people that story, like, stick with it, right? Like, you will see results, but nothing's overnight. You have to stick with it, and don't get discouraged and stop, because that's where people, then you really aren't going to see results.
Exactly. That reminds me of, people who are recovering from surgery. I'm always like, don't look at how you look each day. Like, don't take a picture each day or don't look in the mirror each day and expect to go from pre op to recovery in 48 hours.
Yeah.
Maybe look once a week and assess how things are healing, the progress that you're making. First the swelling's got to go down, the bruising's got to go away, the incisions have to heal. Then you're going to see the shape come out. And I feel like it's so similar. Your results with whatever skincare or injectable treatment you get isn't going to happen immediately, at least not all of them.
Yeah. Even with fillers, right? Like
Hmm.
we say like fillers are pretty instantaneous. You can see a difference, but I will even tell my patients too, like it takes like a week for it to really look natural, for it to kind of settle in, settle down, the swelling to go down. So even something as pretty immediate as hyaluronic acid fillers, right? Even those get better with time too. So yeah, great advice.
Exactly. So tell me, what would you consider like a basic proactive skincare routine? Like, you mentioned sunscreen and you mentioned retinols or retin A. Like,
Yeah.
what would you recommend for someone who's like, I just need the basics?
Yeah. So if you truly just want the basics, sun protection, I know people think dermatologists, like that's all we talk about, but it is so powerful. I cannot stress it enough. Especially the lighter your skin is, you're going to see that sun damage so much more clearly. If you have more pigment in your skin, it's a little more forgiving and you can get away with a little more. But if you are like my complexion or yours, like you are going to see it so early. So I'll tell people like, look at your stomach or, a area that doesn't get as much sun, right? So your stomach or the inside part of your arm, like take a look at that skin and then like flip your arm over in the top part. And for
Terrifying.
most, right, for most people, right, if you're over the age of 40, there's going to be a difference. That skin's going to look different. And it can be really stark. So sun protection alone is so huge, and I'm never going to stop talking about it. It doesn't mean you have to hide out all the time. Just be smart, and make good choices. Like, don't sit in the direct sun, sit under an umbrella, wear a hat when you're walking your dog, or, wear sunscreen, right? Like, just, it can be pretty simple. I'm not saying you have to like be totally covered up with visors and look, like an alien driving in your car, but, just try to make some good choices. Don't go to the tanning bed, right? If you just do that, that's going to get you way farther. Ooh, got my mic.
Whoop.
That's going to get you way farther. See, I get so animated about this. That's going
Yeah.
to get you so much farther than so many people. You see this too. Like some of my older patients who either they burned really easily, so they didn't go out in the sun, or they have more pigment in their skin, and they can age beautifully. Their
Hmm.
skin looks amazing. So that's number one, a gentle cleanser and moisturizer. Like those are your super, super basics. I'm a little more extra than that. I don't want to go crazy, but I am a big fan of a retinol or a retinoid. I think
Hmm.
that's as close to like a miracle uh,
Yeah.
medication or cream that we have. It's one or the most powerful collagen boosters that we have. I know a lot of people want to put collagen in their coffee, and they're doing
Mhm.
LEDs and they're doing all these things, but and maybe they work. There's
Right.
some data that shows that it could work, but if you want 100%, we have so much data showing the power of retinoids and retinol. So I would say add an antioxidant in the morning. That could be a vitamin C. I've been really into plated exosomes right
I
now.
love that
And
brand. Yeah.
yeah. So I think there's really great data for their exosomes. So I'm
Mhm.
using that as my antioxidant serum in the morning. And that's what I do for my at-home regimen.
So it's funny you mentioned the LED mask, like the light masks. I have a cousin who asked me, well, which one should I get? And
Mhm.
it's impossible. I mean, at
Yeah.
least from my standpoint as like a physician, but also a consumer, I was like, I honestly don't know. Like, there's no study to tell me which one actually
Right.
works. And there's like 7 million on the
Yeah.
market. Like, it's
Yeah.
crazy. Do they
Yeah.
really work? Not
Yeah,
sure.
so I mean, and it depends, right? Like we know the in-office ones, they're stronger, more powerful.
Right.
Some people will, I don't know if this is videoed or whatever, anyone watching, like they'll come and get like
Yeah.
an LED that's like a pin. And I'm like,
Yes.
what is that going to do? You have to hold it on your skin for like
Right.
16 minutes in 100 different places. So if you are going to do it, get one that has the red wavelength.
Mhm.
You aren't looking, you don't want someone just to paint their light red. Make sure the
Right.
bulbs really cover all the skin and really mold to your neck, your face, your hands, etc. And you just have to be consistent with it. But I am
Yeah.
curious. I want to know: have you ever used it post surgery to help with healing?
I haven't directed anyone to, and I was given the option to kind of bring one of those in, and I just didn't think it would I didn't think it would be worth the investment in that product because there was so limited data on what
Yeah.
it would do or not do. However, I will say I've had patients who were either, in a subscription plan at a wellness, pop up where they had access to red light afterwards, and they would go into the booths. And did they heal dramatically better? No. Did they heal on the less fair side? Definitely not. I would say they healed average or better, but it's not something, it's not like they healed one half of their body with the light and without for me to really be able to tell.
Right. It's
So,
hard to do those studies. So yeah, I think the answer is it depends, right? And if you
yeah.
want to, if you can commit to it, I know some people are like, that's my morning,
Yeah.
routine, and I meditate and I wear my mask, and like, then go for it. Like that probably has some great benefits for you beyond just your skin.
I totally agree. And that's why I'm like, go for it. It's definitely
Yeah.
not going to hurt what's going on. And if you enjoy it and if you want to pay for it, by all means.
Yeah. Exactly.
So how early do you think I'm in South Florida? Maybe a little bit different than your market in Atlanta, but we have girls here like 11 years old wanting to start some type of skincare routine. Like, no lie, I have members of the staff saying, "What should I allow my tween to purchase and put on her skin?" What do you think is an appropriate age, or what are some starter things that people can do for their skincare?
Well, listen, I'm laughing because I have an 11-year-old at home who is all into his skincare routine and beauty routine. And I like look at his skin. I'm like, you've got the, phenomenal
Right,
collagen right
perfect.
now. Like you are perfect. But yeah, it seems like younger and younger boys and girls, like they want to get into it. They're excited about skincare. And my son is pretty disappointed when he sees he thinks my skincare is way too basic. He's like, where's all your products to like drip and, layer
Oh,
on? So
yeah.
he's seen too much, online. But I would say it's a couple things. First of all, I would say what you do is more important than what you say. So our kids, right? Like they watch you. I tell
Mhm.
my kids, don't cuss, don't yell, and then I have a hard time doing that. So they watch what you do. So if you are constantly like criticizing yourself and how you look, they're going to see that. They're going to hear that. They're going to pick that up. If they see you spending a ton of time, a ton of products, on your skin, they're seeing that too. So try to model like the behavior you want them to have. I don't ever like criticize how I look in front of my son or daughter. I just keep those to
Yeah.
myself. And they always see me. They always see me put sunscreen on. They always see mom grabs her hat when she goes outside on a walk. When we're at the beach, I wear like a rash guard, and they do too. So I think even if they're trying to fight me a little bit on stuff, you know that's been ingrained with them. And then I would say let them have some fun, right? Like
Yeah.
I'm not trying to take the joy out of everything, and let them have fun. I remember being their age and wanting to put on makeup and products, but
Mhm.
they certainly don't need anti-aging, right? Like they
Right.
are what we're trying to get to. So
Yeah.
they don't need anti-aging. I would let them pick out maybe between a cleanser, a moisturizer, or sunscreen. Like let them pick out something that is
Yeah.
fun, that it's not going to break your bank. It's not going to, hurt them, but they don't need actives, right? Like they don't
Mhm.
need vitamin C. They don't need antioxidants. They don't need tretinoin unless they're already breaking out and having acne, right? So I let them have some fun. They love Elta MD, and
Yeah.
so I let them pick out their sunscreen, and they use some moisturizers that have fragrance, which wouldn't be my pick, but they
Yeah.
don't have any skin issues. So I think it's okay just to let them have fun, but just know they do not need these anti aging products. They don't need actives. They just need a cleanser, moisturizer, and sunscreen.
That's good. That's great advice because, you know, the market would sell them all of those things.
Oh my gosh, right. And if like, what are they trying to anti-age from? Are they trying to be five?
Right.
Like,
Too funny. I love it. It's really true that what you said about how they mimic what you do.
yeah,
I bought one of those like ice roller things for my face when I was having all this swelling from this extra filler that I did. And I would just do it in the evenings. I'd put my oil, my cream and my serums on, and then I'd, just kind of massage. And my 2-year-old got a hold of the ice roller one day and started doing it across his face. It was hilarious, like sad but hilarious. I tried to catch it on camera, but of course he like threw it across
yeah,
the room when I pulled out the camera. But it's true. They do what they see us doing.
right. And yeah, like the ice roller, like that is really harmless.
Yes,
If they
exactly.
if they want to do that, fine. Actually, this morning my son was putting it in. I have a little refrigerator in our bathroom, and he was grabbing these little ice things that go under his eyes. It's like,
Yeah.
does he need it? No, but that makes him feel good. So sure.
That's the thing with the ice roller. I'm like, is this
Yeah,
really doing anything? I don't know, but it feels good. Like it's almost
sure.
like just a little zhuzh for my for my little routine.
There you go. Exactly. There's something to be said too for just like enjoying it, right? Like I don't
Yeah,
know why I really don't think it's doing anything for your skin per se, but if it makes you feel good, then that's important.
exactly. So, what are some of the biggest myths you see online about skincare or skin health? Because I'm sure you get asked a lot of crazy questions in your office. Like, what are some things that you have to debunk constantly?
Yeah, I mean, I would say unfortunately a big one is that sunscreen causes cancer.
Hmm.
And it's like exhausting because it does not cause cancer. And when I see people who refuse to wear sunscreen, or they don't put their kids in on, their
Ugh,
kids get sunburned, it
that's so
really like
terrible.
yeah, it just like hurts me because I do a lot of skin cancer surgery. So I see my 60 plus patients who are some of them are coming in all the time with skin cancer after skin cancer, and they're just like so fatigued, and they just keep popping up, and they're always saying like, I wish I had known, I wish I had known. So I really feel like I don't know where it started and how it's continuing to be propagated, but I really wish that like nonsense would go away. Sunscreen does not cause cancer. UV radiation from the sun causes cancer, right?
Yeah.
Another one that I wish would go away is all these like DIY at home hacks with
Yes.
the notion that like natural is better. So,
Hmm.
like, we talk about vitamin C being good for the skin, and people think, well, I'm just going to rub lemon on my face, or or retinol. Retinoids are basically beta carotene. You can get that from beta carotene in carrots. So I'm just going to eat a lot of carrots, right? Like that's not how it works, right? And
Right.
there's this idea like, oh, if it's made in a lab or by a pharma company, then it's bad and dangerous. But really, these companies have done a lot of research and development. They've taken what is a natural product like L-ascorbic acid from vitamin C and retinoic acid from, like the stuff that's in all our cells, right? And
Mhm.
they've pulled out what actually works, and they've been able to amplify it and then mass produce it in a safe, effective way. So I just wish that concept that if it's natural, it's always better, because it's just not the case. So I'm seeing a lot of DIY stuff, like I'm sure you see it too, like flaxseed oil, or no, what was it? The
Yes.
flaxseed mask was gonna be replace Botox and things like that. So
Oh, geez.
yeah.
Yeah. Let us know when that works.
I mean, trust me, if it worked, I would do it.
For sure.
I would totally be doing it, but it doesn't.
Oh my gosh. Well, I mean, I think that kind of brings me to the next topic. Like, you're doing a lot of educating. Like, how do you use your platform to educate? And, what's the biggest, how can we get more of this information out there?
Yeah. Well, it really wasn't until COVID. I used to think like, and I don't know how it was when you were in med school, but I just thought like I'm on this path. I'm going to be a doctor. I'm going to be a dermatologist. I'm going to do Mohs surgery, and then I'm going to practice, and that's it. And I have a practice I love. I love seeing patients, and then COVID hit, and I couldn't go in and see patients. I'm sitting around at home thinking, it made me just totally rethink my life.
Mhm.
And I started listening to podcasts myself. And then I started listening to skin podcast, and I was turning 40, and a lot of people were asking me questions because my friends were turning 40 and I had questions. And what I realized is there's so much information out there, and all these people, anyone can have a platform, right? But it's not always the right information or good information. And what I realized is a lot of doctors and physicians we're not out there actually putting content to the masses. And at least when I was training, it was really frowned upon to be on social media. Like you sort of hid that you had an account, and you would never post about work or being a resident and all that. It was really like looked down on. And this new generation of doctors has really kind of opened up the paved the way, like, well, actually, this is where our patients are, and this is where we can give them information. And I take insurance, and those quick visits, like there's no way I can give all the information and education that someone needs in that quick little visit. So I see this as a way to give kind of free dermatologist approved content for people and education. And then they can use that to either help themselves, because there's just not enough dermatologists out there, or they can now go to their dermatologist kind of empowered with some basic knowledge to have a more fruitful discussion. So I think in the future we will see more doctors doing it, but for so long it was really like, frowned upon to be out there. So I think this new generation, and this is just how people get their information. I mean, I joke I get my news on TikTok, but I'm kind of serious because I can't
Yeah.
watch TV news on the TV. It's too much. No one reads the papers, it seems like. So it's like
Right.
if a story's breaking, I'm going to see it first on TikTok.
It's so true. And everything you said, 100% I can echo. I was one of the first people to start a social media account. Like I was the first person in my residency for sure. But in my profession, like I started general surgery, then I did bariatric surgery, and then I flipped into cosmetic plastic surgery. People made fun of me, for
Yeah.
having an account where I was spreading information, but it's almost like, okay, well, you know, I've educated tons of people. I've gained tons of patients from this, and I'm happy with what I'm putting out there. So I just don't even worry about what the people, with the older mindset think, because at the end of the day, it's for my good, it's for my patient's good. So
Right. And
whatever.
if you're not out there as a board certified plastic surgeon giving this information, someone else is who's not as qualified. So,
Right,
yeah,
exactly. Spreading the proper information, I think, is so key. And that's what your podcast, obviously, and my podcast does. Like, I love
yeah.
having experts on so we can really, get into topics that people want to know about. So I'm so glad that you're doing this as well.
Yeah, yeah, haters gonna hate, right? Like, I think as long
Totally.
as you're, I feel the stuff I put out. I mean, sometimes it's kind of fun and silly, but I do
Yeah.
try to always make sure. I think like if this were on like the New York Times or
Yes.
CNN, like would I feel good about it? I, never
Right.
try to put, patient information
No, of
without
course.
approval and all that. And so I think
Yeah.
there's definitely a very ethical way to do it.
And professional, like you said,
Yeah.
like I was never the person doing like the dances in the hospital, during COVID and all those things that just didn't feel quite right. I was like, if it doesn't feel good, I'm not going to do it.
Yeah, exactly.
So, okay. So I want to get a little bit back to skincare since I have you here and your expertise. What is one piece of advice you wish that everyone would follow when it comes to their skin?
Ooh, one piece of advice. So I'm not going to say sunscreen. I know people don't want to hear that, but I would say
Right.
think about your skin as I would say skin care or skin health is whole body health. So stop
Okay.
thinking of your skin as just your face, right? You got
Hmm.
to think of your skin. It's a whole organ system, just like your heart, your lungs, your brain. All of this, it's all interconnected, right? And so we need to stop like piecemealing it and think about just how what we put on it. So we need to start thinking about how we move our body, what we're eating, exercise, mindset. All of this it shows up in our skin. So I wish people would think of their skincare first and foremost, like more holistically, like how they're taking care of their body as a whole. Because if you are trashing your body, right? Like
Hmm.
when we were like burning the candle at both ends and residency and fellowships and little kids and practice and all this, like it's at some point I was like, I can't keep doing this anymore. I have to finally start taking care of myself and I need to prioritize exercising and sleep and be mindful of how much sugar I'm getting and not just like eating whatever is around because I could do that for 30 some years, right? So,
Right.
yeah, I would say think of your skin health first and foremost, how you take care of your body.
I think one of the biggest things that I still to this day struggle with is drinking enough water. Like something
Yeah.
so simple. Think about our entire body is a cell. And if there's
Yep.
no water in that cell, it's going to shrivel up. So I'm always like,
Yeah.
I need to drink water. I need to drink water. I'm going to look really, really ugly really quickly if I don't.
Yes, I know, right? Like silly things. For me, it's
Yeah.
sleep. Because I was
Yes.
so used to getting by on such little sleep that I thought, oh, I don't need sleep. Sleep is for like weak people. And now
Hmm.
I'm like, nope, sleep's critical.
Yeah. Pretty important. The things we learn with time.
That's right.
So my age range, late 30s, early 40s, like people my age are starting to feel, and you may think this is crazy to feel it this young, but we're starting to feel like our face is falling. What do you tell someone who's like maybe not ready for a facelift or maybe not going to do a facelift, but they feel that sensation? Like, what's some advice that you give?
Yeah. Well, first of all, I would say that actually is like a great age to be thinking about this because
Hmm.
as you know too, right? Like prevention is so key. If we can prevent a lot of premature aging and if we can sort of eliminate or reduce some of these extrinsic causes of aging, you are going to look better for so much longer. So I would say like the fact that you're thinking about it in your late 30s, early 40s is like perfect timing because this is when I joke I'm in my collagen boosting era. So I know when I hit menopause, like my collagen's going to plummet and drop, right?
Yeah.
It does for everyone. So what can I do now? Like now I really need to like start instilling those healthy habits, start doing things to help with collagen boosting. Like for instance, I'd never had a laser before on my face because I just never needed it. I didn't think I had any reason to have one. But then I was like, okay, I'm now in my 40s. I'm like at the perimenopause age. Like I'm going to start kind of just getting like some maintenance laser to help boost collagen. I'm also a big fan of biostimulants. So
Hmm.
things like collagen, radias, this is, going to help boost your own collagen. Again, it's like putting money, your kids are going to college. So you start storing away money into your savings because when they're 18, you're going to have a big withdrawal. So that collagen's going to go. So thinking of these more like pro-aging, these proactive steps can really help, maybe stave off that facelift for 50s, 60s, however, right?
Yeah. Right.
So I think that's like the perfect age to start doing little collagen boosting things. Maybe do some energy based devices, some laser. Maybe if you see some sun damage, start kind of clearing that up, get your complexion more uniform and even. So,
Do
yeah.
you have a favorite laser? Like if
So
it's just aging wise, like boosting collagen.
yeah. So I would say boosting collagen, I would go with something. You don't want to go with the real superficial ones. You want something a little bit deeper. Erbium lasers and
Hmm.
CO2 are really like the workhorses for that. So that I love those. Um, what else? Radio frequency microneedling
Yeah.
can be great, especially if you have some texture changes on your skin or even monopolar radio frequency. I hear mixed results about things like the ultrasound, like high
Yeah. Like the
energy.
soft wave or whatever.
Yep,
I'll say the brand names. You don't
exactly.
have to.
Yeah, yeah. So I don't know. I hear some people who love
Love it.
them, and
And some
then
people are like, it did
right,
nothing. Yeah.
right. So I think there's a little more. I think it's a little less dependable, but like a strong erbium laser, CO2
Hmm.
laser, going deep into the collagen I mean, just amazing.
I know. If only I had the downtime to do these
I know,
things as often as
I
I'd like.
know, I know, right?
That's the thing. It's like, for us who are busy and, filming and seeing patients
Yes,
every day, I get asked all the time, well, what do you do? Or what would you do? And I'm like, well, if I had the time, I would do
right,
this, 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 and this. But the only
right,
thing I've done is this.
right.
I know, life. So, I enjoyed this conversation. I think I just want to echo, once more how, you said that skincare is really whole body care. I talk about weight loss, I help people with, body contouring and things like that. But the skin is the envelope for all of that. And if it doesn't look beautiful, if you're not paying attention to that layer as well, you may not see the results that you want.
Yeah, like you could do the most fabulous facelift, right? But if that skin integrity is not there, it's not going to look as good.
Exactly. I literally had this conversation today with one of my friends, and she's had a lift, and she's like, "Well, what about these lines? I had a neck lift, but I still have these horizontal lines." And I was like, "That's the skin. The extra skin was removed. Your muscles were tightened, but this very top layer, that's stuff that you've got to tackle with your microneedling, your laser, your retinol, like all the things that you see your dermatologist for and your esthetician and you work on around the clock. And I think I'm sure you can relate. It's also something you have to maintain because we're aging every day. You can't do filler one time and think it's going to last you for 5
Yes.
years.
Oh my gosh. And yeah, all the time, like, well, if I'm going to start them on something, or I don't want to do Botox because I'm going to have to keep coming back, or I don't want to do, minoxidil for hair loss or whatever, but it's like diet, right? You don't say like, well, I don't want to eat well because I'm going to have to do it forever.
Yeah.
Or I don't want to work out because I'm going to have to do it forever. I think if you just think of it as, yeah, you're so right about the maintenance, right? It's not like this one, even the most amazing facelift or
Hmm.
liposuction or whatever, like the most amazing treatment is only going to be good for so long, right? You have to do the maintenance at home and taking care of your body, doing the skincare, doing the follow-ups, to really keep those results. But yeah, you're right. Like one syringe of filler is not going to change your life.
Exactly.
Yeah.
Well, I would want to ask you one other question. For someone who's not into aesthetic dermatology at all, what's a piece of advice or what's something that you would recommend just to like the general population about dermatology or skincare? Like, should they schedule a yearly exam? Like, what's something that you feel like the general public needs to know about skin health?
Yeah. So I think it's important to know that even if you were like, like my mom, I can't get her to even use like vitamin C or tretinoin. Like she wants none of that, right? But it is important, especially if you live somewhere sunny like South Florida, Atlanta, or you've had some sun in the past, or any family history of skin cancer. Then get in and see your dermatologist. Get a check. They can advise you. Like I have some patients, especially young ones. No. Where I say there's really no need for you to follow up with me unless something comes up that you're worried about, right? So your dermatologist can take a look at the amount of moles you have, the amount of sun damage, and just kind of guide you on what's normal, what's not. But certainly if you're getting kind of like 35 plus, you've probably had some sun damage, and it could be good just go in for a check. I can't tell you how many times someone comes in for a spot they don't like, that's totally benign, or a spot they're worried about. It's totally benign, nothing bad. And then I'm like, you know what? While you're here, especially for guys, like let me look at your back. Let me look at your
Mm-hmm.
scalp. Let me look at the bottoms of your feet, right? Like places you don't look at that often. And we find something. So I think the safe bet is get in, have a check, and then they can advise you on whether you need to come back. And then I also say it's always good to just have a dermatologist, like to be established with the dermatologist, because
Yeah.
some random rash is going to show up one day,
Right.
or you're going to get shingles or whatever it is, and you're going to be freaking out. And if you already are established with the dermatologist, it's so much easier to get in for that quick urgent appointment than to try to start new with someone then. So that's another reason just to kind of be plugged in with someone.
That's so true because you guys are hard to find for sure.
It's hard to get in. I understand.
Okay. Well, I really appreciate the conversation, Dr. Mina. This has been excellent. I've learned a lot, and I'm sure my audience has as well. Where can people follow you, and shout out your podcast again for us, please?
Yeah, absolutely. This was so much fun. I can't wait to have you on my podcast. Your
Yay.
listeners need to be stay attuned to that. Probably the easiest way to find me on everything is I have an app. You get it on if you have an iPhone or if you have an Android, and has sort of all my content all together. But the podcast is called The Skin Real, REAL, and I'm at Dr. Mina Skin on all the social media platforms.
I love that. So you have your own app.
Do, because I realize I have blogs, I have YouTube, I have
Yeah.
Spotify and Apple. So I just have a branded app, and everything's all in one place.
Okay. I love that. The
Yeah,
Slimming Surgeon app coming soon.
that's right.
All right. Well, thank you again, Dr. Mina. Thank you, everyone. If you're still listening, if you have not already, please subscribe, leave me a 5-star review, and we will be back next week. Thank you.